And you're listening to Morning Report. There's been a dramatic spike in the number of people dying from synthetic cannabis. Provisional figures from the coroner show between 40 and 45 people died in the year to June, compared to just one death in the previous 5 years. The Drug Foundation is among those calling for swift action to get the drug off the streets. Its executive director is Ross Bell, and he joins us in the studio this morning. Good morning.
Good morning.
What's happening here that so many people are dying?
Oh, this is absolutely appalling. The lack of action on this. Last year, when the coroner first announced that about 20 people, that they were investigating about 20 deaths. At the time, I said this is not happening anywhere else in the world. You know, this 20 deaths is unique to New Zealand, and we need action now. Well, now we're at 40 or 45. Which is an absolutely outrageous figure, and there still has been no action, no coordination from the top, no information sharing between different government agencies so that we know what's out there, no extra resourcing for treatment and outreach to these people. I'm appalled.
Who's taking this drug?
Well, that's the key question here. The types of people who are using this very dangerous synthetic cannabinoid products are poor people. A big spate of deaths in Auckland, originally when this was first notified, it was people living rough or disenfranchised young people out in West Auckland. And at the time, Prime Minister Bill English said, we don't, the police can sort this out. Well, no. We need, if we know the vulnerable people, let's provide resources to services who know those people, can provide outreach and health and social services to those people. We can't just say, the police will take these drugs off the street, or let's increase the penalties for this. It's no, how can we get resources and help to these very vulnerable people?
So, given that it's known that it was so dangerous, we had the spate of people dying, there was outrage, and now we have these figures coming out. What should have been done in the meantime? I mean, just resources, that sounds like quite a slow process. What urgently needs to be done to stop people dying?
Well, we need the key agencies to get together, and we urged this to happen at the time. We were shocked when it was 20 deaths. We're appalled now that it's 45 plus. So one of the things, as an example, our criticism at the time is that Customs had known that these drugs were coming across the border 6 to 12 months before they were happening. But when the deaths were occurring, the police didn't tell anyone what the substances were. And so we had border control knowing that the substances were in the country. We had police knowing what the specific substances were, but no one sharing information so that we could talk to those who...
Why not? Why are they not sharing information?
I do not know. I'm gobsmacked. If this was something else, if this was a food poisoning case or contaminated water or something, there would have been a task force and an action plan, and people would have got together and there would have been swift action. So I think there's a bigger question here. Why has there not been that national coordination, that information sharing, resources and help to St John Ambulance, to Auckland City Mission? Why is that not happening?
And when you ask those questions, what do people say?
Oh, can I, I'm disclosing things I probably shouldn't, but when we met with the new government, we wanted to raise this issue, and we were told, no, we have a first 100-day plan and this is not part of it. When it was the previous government, the Prime Minister Bill English said, we'll let the police sort that out. We now have a members' bill before Parliament saying, we're going to get tougher on people who supply these things. That's not what these communities need. That's not what families are asking for. People are asking for more help, more treatment, more frontline support, but we're not seeing that.